Brian Guthrie. I'm the Executive Director of the Teacher Retirement System. It's my pleasure to be here this afternoon. I do have a brief presentation. It should be in your materials. Starting on page 2, I will simply provide an overview of what we do and how we do it. We have 3 main lines of business at the Teacher Retirement System. We have a pension trust fund that is currently valued at approximately $210 billion. We also have reached several milestones within the pension fund I wanted to mention. We now have over 2 million members. That distribution is 1.5 million active members and over 500,000 retirees. We also pay out more than $1 billion per month in annuities. The total now is about $15 billion per year, and that is continuing to increase. And TRS Care is another major program that we manage. As was mentioned by the LBB, the changes that were made to that program back in 2017 have been very successful in terms of putting that program in a much better financial place. We find ourselves in a position today where we have a healthy fund balance. As a result of that healthy fund balance, we were able to lower premiums for Medicare Advantage members this past summer, as was also mentioned. Those premium reductions went into effect effective January 1st of this year. And then finally, we also manage the TRS Active Care program. That is a health insurance program for active members. Not all school districts participate in that program, but many do, of all shapes and sizes, small, medium, and large. And as was mentioned, we cover about 400,000 plus members in that program. There's also $450 million included in the base bill for an effort that was started last session to allow us to increase premiums, but by no more than 10% per year, to allow us to get those premiums back to the market level that they would otherwise have been had we not frozen premiums the year after COVID when we received federal dollars for that purpose. You turn to page 3. That's just a statement that the pension fund is actuarially sound. This definition of actuarial soundness is in statute, which is a funding period of less than 31 years. You can see that we are currently at 28 years. And our investment return last year, as of August 31st, was 12.83%. One milestone that you will be looking forward to and that we will provide you in the near future is we are required to update our actuarial valuation as of February 28th of this year. So we will do so. We have just a couple of weeks left in that time period before we do the reevaluation. But I can tell you that unless there is a significant change in the market dynamics between now and then, that we will continue to be actuarially sound, and our funding period will likely remain around 28 years. So that is what we anticipate at this point. You turn to slide 4. That shows our pension trust fund performance over time. You can see, we go up and down, but primarily have been trending upwards since 2014 over the last 10 years. I do have our returns at the bottom as of 1, 5, 10, and 20. Senator Schwartner is no longer in the room, but I did want to, for his benefit, share that our 3-year return was 3.01%. That is not unusual for that time period. The S&P and the Dow was down significantly over that 3-year period as well. And so our returns were muted, but we were still positive. As a mature pension fund, I think it's important to note that approximately 60% plus of our pension fund revenue comes from investment earnings. So that means that when we're paying out $15 billion in pension benefits on an annual basis, only about 30% of that comes from the state or members. The rest of it comes from the pension investment returns. Turning to slide 5, just a brief summary of what was in the appropriations bill. I don't need to go over this since the LVB already has. We are very grateful for the continued support that this body has shown. I also would be remiss if I did not thank this body for their efforts last session on the part of our retirees for the additional benefit enhancements that were provided. You made the wise choice to provide $5 billion in additional funding up front to help finance those pension enhancements. We've already started investing that money, and our members started receiving those benefits about a year ago last month.
All right, Senator Perry.
Thank you, Madam Chair. Regarding TRS Active Care, I think it's been 3 or 4 years back when they got to opt out, and several districts opted out.
Yes, sir.
They've recognized the error of that decision in a great way. Very few think now that was the smart thing to do. They are coming back in. Do you have a number that the legislature will probably be faced with in the next budget cycle of what that fiscal impact will be?
So we haven't calculated a fiscal impact yet, Senator, but I will say that we are very mindful of the fact that that first 5-year window is about to open for those districts who did depart. We would anticipate that many will return. We haven't seen their claims data yet to know exactly how it will impact.
Do you have an idea of just census, just body count? How many people are out of the system? Because I can tell you in my district, I'm expecting a 90% return rate minimum. I mean, it's significant. So what is the volume or census data coming back?
So I'm going to ask my Chief Healthcare Officer, Katrina Daniel, to dive into those numbers for you.
Okay.
Good afternoon, Senator. Katrina Daniel, Chief Healthcare Officer for the Teacher Retirement System of Texas. We're hearing the same thing you are. The thing to keep in mind about active care is while we have been getting last session we received state revenue. That wasn't really, it was really just a feature of having received federal funds for COVID expenses, holding the premiums constant as we were directed in that first year. And then, as everyone here knows, when you, and effectively what we did, because we were rolling out regional rates at that same time, we effectively lowered premiums by about 5%. So anytime you use one-time money for ongoing expenses, especially expenses that grow, you're going to need more money the next time. And so when we talked about that, we were looking at about a 28% premium increase to make up that difference, as Emily mentioned, to return the revenues to the expenses. When we talked to you all, the governor, you all decided to fund the $588.5 million last session, directing us to keep premium increases on average to a 10% increase. So we've been on that trajectory, and we don't anticipate needing additional funds. And in active care, except for these funds to make up that delta that was created by using the federal funds to lower premiums, except for that, premiums cover the cost of active care fully. So any funds that the state allocates to the districts goes through their formula funding, then they pair that up with what the employer wants to contribute, payroll deduct from their employee and send it to us. So we will, that's a long way to say we will simply set premiums to cover expenses.
Yeah, so you just gave a politician answer, whether you know it or not.
I don't have a head count.
Just straight through. Just straight through. First of all, what I just heard you said, there's really an 18% delta that we've not covered based on your last projections. Possibly.
Yeah, if the legislature were not to fund the $450 million that we requested in
which was capped at a 10% increase.
That $450 million reflects what we think we would need to maintain that path of a 10% increase.
So I don't want to get into, and you can come talk to me. You opened up a different conversation through talking too much, just for training purposes. My simple question was, a bunch of people bailed out of active care 5 years ago. They're coming up on their anniversary. Majority of them are coming back. You know how many bailed 5 years ago.
It was about 30,000 people.
30,000 people. Okay, so we can start there and assume that at least 30,000 people, 90% of them are coming back. Average cost to the state to maintain the 450, the 10% base you can get back to me on that. Don't worry about the math today in front of the committee, but I'm just looking at what we're facing next session from that. But what I also heard you say in your conversation, we artificially capped the increase in premiums by 18%.
No, by 10%.
By 10%.
18 is what we would need if we didn't get funding. I guess I'm saying I don't anticipate us requesting funds next session, regardless.
Okay.
And
Well,
so,
here's what I'd encourage you to do. Do not build a hole that is a $2 billion problem. Do you get what I'm saying?
yes,
So
sir.
we artificially capped, 450 million is what we agreed we could afford at that date. But if 450 is deferring an inevitable $2 billion conversation, please let us know that we're being a little short-sighted because we can eat the elephant one bite at a time instead of the whole elephant at once. I don't know if that's
Yes,
where
sir.
we're going. As typical TRS conversations, nothing slam on y'all guys, but y'all seem to talk around really well the legislature. Just saying.
Well, I appreciate that, Senator Perry. To directly answer your question, the $588 million you appropriated last session, the $450 million built into the base bill this session would allow us to avoid that $2 billion hole that you mentioned. The goal of that funding, and it is achieving its desired outcome, is to get us back to a point where we can, again, manage this program through normal premium increases that would not impact the amount of revenue that we would need from the state.
Just to complicate matters further, as I recall, the state has a set rate that we pay each one. Isn't it $75 per teacher? Am I correct on that, or am I conflating?
So there's a reference in statute to a $75 per employee state contribution per month.
Okay.
But I think you've also passed legislation when you've increased the basic allotment that referenced, that employers could spend what they want to on healthcare.
Right, but the state obligation is 75 per. So if more come in, the state is obligated a certain amount, and then we
Yes.
tried to control the premiums being raised. Again, this was something extra that we were putting into the school finance system to help teachers because we didn't want the increase to go up, right? That were their premium. So now after this session, it's almost $1 billion we put in to control those. But that was something supplementary that we did, but not required by statute.
That was not required by statute.
Okay,
That's
that makes
correct.
sense. So I don't know how many people might come in, but if they do, what we're obligated is a certain amount. Then the school districts and the teachers, they have to kind of work out, how they're going to, if the premiums go up, how that's going to be paid, and then it's a appropriation decision as we move forward, how much we want to help them. Does that make it more confusing or less?
No, that's right on target. I think what as we always do, retirees and active, we want our teachers' paychecks to stay whole,
Right.
and we've kind of done that now.
That's
as a
why we did
president.
it through supplemental funding.
Unfortunately,
Very
we don't.
targeted.
I've said it before, and it's not disrespectful. It's just we don't get no love for that when we maintain premium costs because they didn't see a premium increase that we paid. But I'm just looking out here on the horizon. They're going to see significant increases in their health insurance costs. And I'm not suggesting that's our issue, but it also goes back to districts are pressured. We're funding money to do, we put money in one pocket and then they get hit on it's like property tax, right? Mm-hmm. We've bought down property tax and then insurance went up. So it's this constant seesaw. Yeah. So I don't have the answer, Madam Chair, but I'm just saying it seems like we've opened up that conversation in a big way the last two sessions. And I think we have options. It's just, can you get the narrative out to understand, people can understand how much we've done?
That's the hard
part. That's
part.
a challenge, right?
Senator Colcourse.
Thank you, Madam Chair. Good exchange. I'm going to just jump into the cost of health care real quickly. What are your cost drivers in active and TRS care?
As you've heard from others, it's neoplasms, GLP-1s, specialty drugs are huge drivers right now.
Are y'all cooperating with and working with TPI at this point?
We are. My first meeting this morning was with Mr. Giesland.
That's your first meeting?
Yes.
No, just today. Her first meeting today.
Today's first meeting.
Yes.
Y'all have met with them several times.
Yeah,
many times.
Miss Daniel is our representative on TPI and
Thank
has been working with them the past year.
Okay, and we'll hear more about this as we move forward in trying to get some buying power there or to cut through and and find some cost savings for the taxpayer, because ultimately the taxpayer, other than the portion that our retired teachers or our actives are paying, it's all funded by taxpayers, whether that's coming from the school district or coming from us. Being the Texas, the General Appropriations Act. I want to work with y'all, and I'd like to see you and I worked on the Affordable Care Act way back when, and
I remember it well.
yeah, we had a lot of charts in my office. I like to do flip charts, so come see me and we'll work through the healthcare side of that. Health and Human Services has insurance, but we work with the chair very closely on this.
Yes.
Okay, and so my other question was, with Senator Creighton, he had a good exchange, and he had to step out just momentarily, and it texted me, and I want to make sure that we fully understand this, so I'm going to go to just TRS now, is that he wanted me to make sure that his clarification with the LBB about Senate Bill 2, which he wanted to clarify has zero mechanism to grow either in funding or students served. I think the LBB affirmed that unless the legislature comes back and appropriates more money, and said that that they projected to 2030 was wrong, maybe in error, or maybe aggressively looking out. It has to be an act of the legislature. So we have heard from our retired teachers, and I want to make sure that they their fears of, if SB2 gets to the governor's desk, will it have an impact on TRS?
No, ma'am, it will not. I have seen the same social media posts and the same information that is alarming our retirees. We are somewhat constrained in how we can respond because we are not allowed to lobby or have the appearance of lobbying. But let me make it crystal clear, and I very much appreciate the question, Senator Colhorst. Our actuarial analysis of Senate Bill 2 shows that there will not be an actuarial impact on the fund if the legislation passes. There's a number of reasons for that. There's also the basis for some of the exchanges that you see on social media referring to a 12-year period at which point the fund would become insolvent is actually a hypothetical, that it was a hypothetical exercise the actuary was showing to demonstrate that the numbers that we've seen based upon how SB2 is constructed and the number of students that you expect to move from public education to private education is not demonstrably large enough or anywhere close to being large enough to have an impact on the fund that would move the needle.
Well, thank you for the clarification. This is a fund that, Madam Chair, I think you've worked on this many years. When I was in the House, I worked on it through Article 3, and it ranks as in the world as how big of a retirement fund. Sometimes I see fifth or sixth largest.
Sixth largest in the country.
Sixth largest in
the North America.
In North America, that's a large fund. So I want to make sure that our retired teachers understand the work of this legislature. Madam Chair, you have led the charge since I've been in the Senate that we have worked to get actuarially sound. We've done 13 checks. I know at least twice. And then we did a COLA this last session, which
And we've invested more. The state's contribution level has increased dramatically in the last, 5 years. So we make an ongoing.
And say that out loud. What does that mean?
It means that we went on a kind of a tiered program of putting more and more to help them reach actuarial soundness, and we're there, as Ryan has reported. And I don't have the exact number in front, but it's billions of dollars every biennium. And we're committed to do that. We have to do that from now on. We're in the forever business, like I have to say. It's a long-term commitment. It would make no sense for us to pass legislation that tanked that. So back to your SB2 question. I mean, of course we have looked at this. Of course we are committed to not doing anything to hurt our retired. It would be stupid to do it. I mean, we're putting billions into it. We wouldn't cut our own throat. So we're here for the teachers, and we're here to make this fund long-term forever. We're in the forever business, and I got that from TRS long ago.
Thank you, thank you. Thank you for the clarification on that. And I look forward to working with all of you on healthcare costs in general. I mean, whether it's TRS Active, TRS Care, your own, for those listening that are employee-sponsored insurance, ERS, all of it. We have to drive down the cost of healthcare because no one's going to be able to afford it eventually. So I look forward to working with all of you.
Thank you. Senator Betancourt.
Thank you, Madam Chair. And let me try to make this a bigger corollary than just SB2. One thing you could say to your the folks that you're in communication with, unless it's a piece of legislation that is actually of the subject matter of a pension, it can't possibly affect the plan, right? Is that not a more positive statement we could make?
You could in many cases. I think.
I'll give you an example. Does SB4, does the homestead exemption somehow affect the plan?
Oh, of course not. No.
Does the bond, bill that Senator Huffman is carrying affect the plan?
No, sir.
Okay. Well, the misinformation is so great on social media that as positive of a lock as statement as you can make would be appropriate, because unless a bill is actually targeted or designed or talking about that specific area, it's going to have no effect on the plan. True?
Generally, yes.
Yeah, I mean, I'm not even sure what the general exception is unless there's something in a bill that targets that specific mathematics.
So I think in the case of Senate Bill 2, not to belabor the point, but there is a concern that if you lose headcount in public schools, that would at some point also result in a loss of employees at district or level or state level. The analysis that we have done shows that even with that kind of potential loss, it would not have a material impact on the fund.
Right, because if you actually looked at the gain or loss, while it might be possible on a student basis, but it's on a weighted ADA basis, there's no chance, okay, because the weights of the ADA and the funding formula are so substantially higher than just pure ADA. So I'm just trying to say, as positive of a lock on a statement would be good, okay?
Yes, sir.
All right, thank you.
Thank you.
All the questions we have for you, as usual. Thank you so much for the hard work that all your team does for the retired teachers of Texas. You're doing a great job, and we always enjoy having you here for your presentation.
Thank you, Madam Chair.
For being here. All right. Okay, we'll move on.